The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and, of course, J.D. Angelis, our technical producer. In the studio with me is Brad White, a compounding pharmacist, and our very special guest today is Dr. Paul Turgeon, ophthalmologist and eye surgeon from Eye Centers of Ohio. Today we'll be discussing the diagnosis and treatment of cataracts and other situations. Good morning, Doctor. Welcome to the show.
Good morning, Paul, Brad, JD. First of all, I'd like to just say thank you for inviting me to be on your show. It's a pleasure and privilege to speak with all of you today.
It's always good to have you on, Doctor. You're a favorite guest.
All right, so we're going to talk about a number of different things today that Dr. Turgeon's an expert in, but we wanted to cover that, some of the things, blindness is probably one of the most feared disabilities, although it's believed that half of all blindness can be prevented. The number of people in America who suffer from vision loss continues to increase. The leading cause of vision impairment and blindness in the U.S. are primarily age-related eye diseases, and the number of Americans at risk for age-related eye diseases is increasing as the baby boomer generation increases. So these conditions, including age-related macular degeneration, cataract, diabetic retinopathy, and glaucoma, affect more Americans than ever before. Disturbingly, the number of Americans with age-related eye diseases and vision impairment that results is expected to double within the next decade. So we'd like to remind our listeners today that our program is available on our podcast, so you can go to the App Store of your favorite smartphone and look for Health Matters with the Medicine Center Pharmacy, and you can download our program and take it with you. And if you have questions you'd like today to ask, you can post them up on our live Facebook feed, or you can give us a call here at the station at 330-450-1480.
So, Doctor, tell us a little bit about yourself and our listeners. And I know you do super work because both my wife and I have had our lenses replaced with you. And it really is an interesting scenario. So tell us some stuff.
Well, I've been practicing ophthalmology here in Canton for 30 years. I'm on staff at Altman Mercy, and we work with a group of 5 ophthalmologists at Eye Centers of Ohio. We are a full-service ophthalmology practice. We handle everything from cataracts or surgical, dry eyes, diabetes, macular degeneration, oculoplastic surgery, anything that would glasses, contact lenses, LASIK, anything that would help your vision, we can help you with it.
You have glasses, contact lenses, all available in your offices. Is it both of them or just the one now?
No, we have 2 offices. One right here in Canton, just a few blocks from here, and one up for our patients in North Canton.
Okay. The newest doctor is
Dr. Michael Smith joined us recently, and he's an excellent surgeon, excellent guy, and he's looking for new patients or anybody who's.
Hey, great place. Why'd you do this? Why'd you want to be an ophthalmologist?
Oh well, ophthalmology is. I think it's the greatest profession. I mean, we get to you get to know people well, like yourself, your wife. We get to help people fix things, see better. It's a very rewarding to take somebody who's having trouble seeing and give them good vision once again. People are so thankful for that.
Now, when you came into practice, the laser didn't exist, did it?
No, that's a new development. The other thing about ophthalmology, it's very high-tech oriented. So new developments in medicine a lot of times start with ophthalmology. The first place to do microsurgery was with eyes. Now you see it through cardiovascular, renal, all through medicine. Surgery are using microsurgical techniques, laparoscopy. Using microscopes to do the work was started in eyes. Lasers started with eyes, with retinopathy, treatment of diabetes. Implants started with eyes.
So the laser started with the retina first.
Right. Now you see that all throughout medicine too. transplants. The first organ transplant was a corneal transplant. So innovations are ophthalmologists are very forward thinking. Not that I am, but I build upon the shoulders of the people who came before us. But there's exciting stuff always happening. There's new stuff happening even now. New stuff happening on the horizon now that keeps it fun at all times.
We're still using a scalpel, right, on the eye as opposed.
For certain things, but a lot of places the laser is starting to take over there because we can use the laser is more precise than a hand-based scalpel. So with LASIK surgery, for instance, or surface ablation PRK surgery, the laser is you can wipe away astigmatism and nearsightedness and farsightedness to put people with near perfect vision. And that's something we could not do with a scalpel. Cataract surgery is now being more and more surgeons are moving to the femtosecond laser, an ultra-short pulse laser that can make the incisions more precisely than a surgeon can by hand. And with that, we think we have a safer operation and a more accurate operation.
What about the LASIK? I know it's been around a long time. Is it still real popular?
Oh yes, it's more and more popular now. The LASIK was extremely popular 20 years ago, but it's population dependent. So there was baby boomers who were very interested in freedom from glasses. Many of those patients have aged into the cataract populations now.
Yeah. Okay.
So the LASIK is not as prevalent as it was because there aren't as many people that age group, but it's
not permanent though, is it?
Oh, sure it is. It is. It should be.
I guess I keep hearing on occasion somebody saying, "Well, I got to go back and have it done again because it doesn't last very long."
If it's like glass, it should last. I mean, we've had people for years, for the rest of their life it lasts. But just as if you might have a pair of glasses 20 years from now, you might not. That same pair of glasses may not work for you, but it's going to be close. There might be small variations.
I see.
Okay, but it's...
So what is that baby boomer crowd moving on to now? Back to glasses or new lenses, or what are we doing here?
Well, that baby boomer generation now is in the cataract population. A lot of those people are now in their 60s,
okay.
And so they're having other eye problems, and so the system is being taxed heavily by the baby boomer generation.
So what's the new generation, Z or something? What did I hear the other day? The next generation behind the current,
I know we had X
or something.
Y,
whatever. Yeah, whatever.
Guess we got to start over then after that, right?
What is
AAA?
AAA.
What's with them in their eyes? In any?
Yeah, how are the phones treating our youth?
Yeah.
Phones?
Or, just the screens.
Or computer. We get a lot of questions about that. Are computers damaging to the eyes? And there's really no evidence that the radiation or actual physical damage comes from overuse of computers. Now, computers can make the eyes feel strained and can aggravate dry eyes. A lot of people, older people, even younger people, have a lot of problems with dry eyes now. And so computers can sort of aggravate that. We can talk about that a little bit.
I saw on the news the other day they were talking about this bone thing that was growing on younger people below their earlobe or something like that. Did you catch that thing? That story?
I missed that. Did you?
Come on. I don't know if it was a hoax or what it was, but I thought, if anything, with them looking at their screen like this, they don't talk to people anymore. They look at their screen. If anything, the eyes are certainly suspect to have some issues of like you say, dry eyes, stuff like that. So,
well, why don't we talk about age-related macular degeneration and what are some signs and symptoms, and what should patients look out for?
Well, AMD, or age-related macular degeneration, is a condition where the light-sensitive cells of the macula become damaged and stop working. The macula is a central part of our retina that we use for fine visual tasks such as reading and facial recognition and watching television. Though it never leads to total blindness, AMD can cause the vision to become blurred or distorted. straight lines might appear wavy or kinked. And in more advanced cases, patients often notice a blank patch or dark spot in the central part of their vision. To help reduce the risk of this condition, you should eat at least 5 portions of fruit or vegetables per day, especially the green leafy type of vegetables like spinach and kale that contain lutein, a chemical that protects the macula from damage. A new type of monoclonal antibody drugs known as anti-VEGF therapy are now available to treat the wet AMD. Anti-VEGF medications such as Avastin, Lucentis, or Eylea are given as injections that help stop the progression of macular degeneration. Researchers are also working on other developments and treatments for AMD, including one using stem cells to treat 90% of the patients who have dry eye types. And these are some of the new advances that we were speaking about. Trials will start probably in the next 2 years.
Tell us about the retina. It's like a TV screen. Is that about right? All kinds of innervations.
Well, the retina, the neurosensory retina, is a part of the back of the eye. It lines the back of the eye like wallpaper, and it's full of light-sensitive cells called photoreceptors that then transmit the images to the brain. So you look at it as a light is coming.
So it's more like a camera than a TV.
Well, the eye is built very much like a camera. The camera is modeled after the eye, probably is the way we should look at it. In the front of the eye, we have a lens. We have the clear cornea, which is a window that lets the light through. There's a lens right behind the colored portion of the iris that's there to help focus the light to the retina. And the retina would be like the movie screen or the light-sensitive screen that then
it's hard to
captures
imagine
the image.
That the image is really in your brain, right?
It is.
It's not. The eye is the camera, okay?
And the brain does the seeing.
I kind of explain this. The brain does the seeing. It's hard to imagine when you...
And there's people, for instance, a way to think about that is if a person develops a stroke in the back of their brain, they can lose half of their vision, maybe even more, and their eye is perfectly fine.
Oh, that's interesting.
We have other cases for children who develop lazy eye or amblyopia. The eyes are perfectly fine, and say, well, can I get a stronger glass to make my eyes? Your eye is fine. It's just that the connections from the eyeball to the brain never developed. So in the amblyopia, which is lazy eye, the two eyes are both seeing, but one sort of dominates, takes more of the connections to the brain. And so to help that, we have to patch off that good eye to make the weaker eye become stronger. And that's one of the reasons why we try to hope to see all children before the age of kindergarten or first grade, so we can catch children, so we can change that, influence that.
First break's here. You're listening to Health Matters at the Medicine Center Pharmacy. Hi, Paul White for the Half Off and Hot Buy store in Louisville. Just in, an entire drugstore inventory with lots of good stuff. Toys, electronics, cell phone accessories, women and girls Levi's, beach towels, and best of all, Starbucks coffee. Toys, lots on sale. We have to sell all remaining furniture inventory drastically reduced to add space for incoming merchandise. Also, many final reductions around the Half Off and Hot Buy store next to the Medicine Center Pharmacy in Louisville. Don't miss this sale. You'll regret it.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Paul Turgeon today, ophthalmologist, excuse me, an eye surgeon from Eye Centers of Ohio. Have a question, post it on our live Facebook feed or call us at 330-450-1480. Is that right?
That is right.
That is right. Okay. So, Doctor, you're back on the stage.
Thank you. Good to be here.
Okay, good.
All right, so you mentioned you were telling us about AMD. How about there's more than one type of AMD?
Yes, there are two types, wet and dry. The labels are based upon how the condition appears, not how it feels to the sufferer. Dry AMD is the most common. It affects about 90% of all sufferers. It develops slowly, causing a gradual loss of central vision. Unfortunately, there's no effective treatment. But sometimes optical magnifiers and other devices can be helpful for reading and other detailed tasks. Now, the other form is called wet AMD. It's a less common, but much more devastating. And it results from new blood vessels growing behind the retina. This causes bleeding and scarring, which then leads to some loss of vision. Wet AMD can progress very rapidly and cause devastating sight loss more so than the dry form. But this is where these new promising drug treatments with anti-VEGF have come into play that can prevent further deterioration and even restore some loss of sight.
So, okay. You put eye drops in your eye, okay. How do they, is that the typical treatment you're talking about for this new therapy or not?
No, we have to inject the medicine directly into the eye.
Okay.
Yeah, so it requires a series of injections. But, before we had these medications, people lost all of their central vision, were legally blind. And so a lot of times we can save, it requires periodic injections to maintain it, but it is very effective.
How do you do that? Do you do it right through the eyeball? Or?
Yes.
Ugh, that's ugly.
You don't feel it, right?
Jeez.
That's going to hurt me a bit.
It has to be a very fine gauge.
But we do numb it up.
Yeah, that's good. That has to be a very, very fine gauge needle, I would think. And otherwise you would damage the integrity of the eyeball, right?
Well, you don't want it if you don't have to have it.
For sure.
But if that's what's keeping you from going blind, it's well worth it.
Wow. That's hard to whatever. So tell us some things about what your practice does. I know you do lens replacement. I know you do LASIK. Some odd things that come across your office, ophthalmology type things, and
anything that goes wrong with the eye, people can walk in for. Most common is blurred vision, loss of vision, and since most of our patients are getting older, the most common thing would be cataracts or macular degeneration. We treat a lot of diabetic retinopathy. As you know, in pharmacy, there are many, many people with diabetes mellitus, and that causes serious vision loss if it's left untreated. Now, fortunately, we've made great strides in the management of diabetic retinopathy. Strict maintenance of the blood sugars and blood pressures have really reduced the risk of blindness. When I started in ophthalmology 30 years ago, it was common to be blind from diabetes. but the American Academy of Ophthalmology, the internal medicines, the diabetologists have all made a strong push to have patients with diabetes aware of the problems, and the loss of vision from diabetes has dropped dramatically.
So this is caused by not only high blood glucose, but blood pressure issues also.
Sure.
Okay.
You can think of it as the high sorbitol levels or glucose levels will damage the pipes or the vessels, and then high blood pressure further damages and pushes the fluids right out of those leaky pipes.
Interesting.
We think, diabetes is the most common cause of preventable vision loss. So we hope that we can stamp it out, because the key word there is preventable.
Sure.
So for a public service announcement, if you have diabetes, it's a good idea to see your eye doctor at least once a year, correct?
Definitely.
And
correct.
Don't be, I know we talked about needles, but don't be afraid to get an eye exam to make sure you prevent further damage if you can head it off at the pass first, right?
Sure. Yes, diabetes is certainly treatable, and not only eye problems, kidney problems, heart problems, strokes. These things are all intensified with diabetes, and we want to knock out all those diseases.
Well, of course, the stroke can happen pretty much in the brain, but excuse me. So many people do get partially blind from a stroke, right?
It can happen, sure.
Okay. I mean, I don't know what parts of the brain or the optic.
Well, the back of the brain, called the occipital cortex, handles the vision. So if the brain is fed by a number of different blood vessels. If the vessels that feed the back of the brain are affected, then yes, you can lose vision with it.
Okay.
So what about dry eyes? Does dry eyes happen more? I'm thinking, I feel like it should be more in the winter when the furnaces are roaring and the air's drier. But what about, does it matter seasonality, or is it a condition that is consistent?
No, you're right, Brad. It is more common in the winter because we have a lot of forced heat furnaces, which burns the water out of the air. And humidity is lower in general in the wintertime. So that's when it's most problematic. But dry eyes exist all year long. Dry eye is a term that covers a number of conditions that are characterized by a lack of good quality tear production. So the eyes become dry and painful. And so central heating in the winter, air conditioning in the summer, and regular computer use can all make it worse. It's thought that around 15% of all adults over 40 have some aspect of dry eye, and it affects twice as many women as men.
Interesting.
It might not be possible to identify the exact cause and provide a permanent cure for dry eye, but there are a number of effective treatments that reduce symptoms and can improve the comfort. Lubricating eye drops can soothe and reduce the irritation, and special plugs can be inserted into the drain channels to stop excessive tear loss. There's newer prescription-strength medications available now, such as Restasis and Xiidra, that can suppress the chronic inflammation associated with dry eyes and actually increase the production of natural tears.
Hold that thought. We're going to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Hi, Paul White for the Half Off and Hot Buy store in Louisville. Just in, an entire drugstore inventory with lots of good stuff. Toys, electronics, cell phone accessories, women and girls Levi's, beach towels, and best of all, Starbucks coffee. Toys, lots on sale. We have to sell all remaining furniture inventory drastically reduced to add space for incoming merchandise. Also, many final reductions around the Half Off and Hot Buy store next to the Medicine Center Pharmacy in Louisville. Don't miss this sale. You'll regret it. Incontinence. Nobody wants to talk about it, but many people have to deal with it. Hi, Paul White from the Medicine Center Pharmacies. We recently made a large purchase of underpads and adult diapers. Many brands are now in stock and all at half price. You can save many dollars by purchasing these incontinence products at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. We also have compression hosiery, many brands in stock, and all at gigantic savings. Stop into Medicine Center Pharmacies and save on all your healthcare needs. You're listening to Health Matters at the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing cataracts and other eye issues with Dr. Paul Turgeon. We have a lot more to cover this morning, so let's get back to the show.
You know, glaucoma is a very serious disease process, but that a lot of people don't know they have. It's often referred to as a silent thief of sight.
Do they not, a person that develops glaucoma, do they not have visual issues or?
Not at the beginning. It's a silent disease. Now, near the end, it can be devastating, leading to complete loss of sight, blindness. Sure. Yeah. The most common kind of glaucoma, called primary open-angle glaucoma, affects 2 in 100 in people over the age of 40. Risk factors for glaucoma include increasing age and a family history. And it's more common in African Americans. Glaucoma leads to permanent loss of vision and untreated complete blindness. So people don't know they have glaucoma because it doesn't produce any symptoms until the end stages. So the vision loss starts out in the periphery of the eye when people don't really notice what's happening.
So you only catch it in a routine exam then? Would that be accurate?
Right. We have to measure the intraocular pressure or we check their vision. Intraocular pressure, the eye is filled with fluid, and like a tire would have a certain pressure to keep it pumped up. If that tire gets pumped up too high, it can burst, or if the eye gets up too high, it wears down the softer parts of the eye, particularly the optic nerve. And the optic nerve, as we discussed earlier, carries the vision back to the brain. So if the optic nerve is damaged, the vision is damaged. Well, now,
has the measuring equipment changed markedly or not?
No, I think the measuring equipment, there's different methods, but it's basically the same. We're measuring the intraocular pressure, and that's something that's done at every eye exam.
Okay.
Ideally, everyone over 40 should have their eyes checked every 2 years. And people over age 40 who have a child or a parent, brother or sister who already have known glaucoma should have annual checkups.
I know that the eye drop technology has improved dramatically over my career.
There's new eye drops coming out all the time. In fact, in the last year, we have 2 new ones, Vyzulta and Ropressa, which all the medications are extremely helpful. So glaucoma can be, in many cases, easily controlled by just putting an eye drop or 2 eye drops in a day, which is well tolerated.
Biggest problem with an eye drop is getting it in your eye. Really.
Yeah. It can be a challenge at the beginning, but people get better at that.
Sure.
At the time of cataract surgery now, one of the new advances, new technologies, is being able to insert little stents into the drainage channels that increase the outflow of fluids and often reduce the need for chronic drops. So that's been a real advancement. We see lots of research and new technology coming out to treat glaucoma surgically.
It must be extremely tiny. Huh?
It's the smallest implantable device in humans is some of these little glaucoma stents, a number of different competing technologies.
How in the world do you get them in there? I mean, I guess eye
stents, and
I understand the magnification and the whatever.
But we work with operating microscopes. They are very tiny. They're difficult to see with the naked eye, but with a microscope, and they're, because they are difficult to work with, they come with tools, injectable tools that allow us to hold it and insert it properly.
Amazing.
Incredible. Just unbelievable. Okay, everybody's got black spots in their eyes, floaters and all that kind of stuff. I got floaters. Okay?
Do you?
Yes, I do.
I got a few myself.
Yes, okay. Why do we get those?
Well, floaters, as those black spots are called, are very common with increasing age. Sorry, Paul.
Hey. I'm older. What can I say?
As I am too. They're caused by a change in the vitreous humor, the jelly-like substance that fills the eye. Gradually, the vitreous at birth is kind of a semi-solid, but gradually over the course of the lifetime, the vitreous separates into a liquid part and a more fibrous part. The fibers which clump together to form spots and specks that are seen in the field of vision. There may be particularly troublesome when looking at a light surface such as a pale blue sky or a page of a book.
I'll every once in a while I'll be sitting watching TV, and a black spot will come across my eye, and I think, is that a bug or was that a black spot?
Hit it, the gnats.
Yeah.
Now, the vast majority of floaters are harmless. And the body kind of gets used to them, and you sort of learn to ignore them after a while. So we don't really worry.
So we don't want to dissolve them, or we can't dissolve them. Or
there are technologies sometimes where you can laser them away, or actually do a procedure where you suck the vitreous out of the eye when the floater is with it. But most of the time there's some risk to that. So we encourage people to try to ignore them.
So it's not a sort of a problem where somebody would get a large one.
Well, no, that's a very important point. I'm glad you brought that up. If you suddenly develop a lot of floaters or a very large one, especially if it's accompanied by flashes of light, that might signal a serious problem with the retina, such as a retinal tear or retinal detachment. Okay. And if this happens, you should definitely see an ophthalmologist as soon as possible.
How does it tear? I mean, banging you hit your head or the retina? Or
I've seen that happen. People fall and it shakes things and tears the retina. The most common cause of tears is that vitreous shrinkage process that we talked about.
So it falls away.
It falls away. As it peels away, it's trying to peel itself away from the retina as it's shrinking, and actually it's stuck a little too tightly in some areas, and it might tear a piece of the retina off with it. That's the most common cause.
And it shrinks? Why does it shrink? Age, wear out, it's just tired,
I don't think we know exactly why. No, not that. It's age. It just changes its consistency over the course of a lifetime. Okay. And eventually the weight of it just collapses upon itself. And you'd like it to just shrink up and pull away cleanly, but sometimes you can accidentally, or not accidentally, sometimes it can tear the retina in the process.
Okay. I guess we're back to cataracts now, or unless we already hit this. There's a question here about developing cataracts, and my wife and I both had ours removed from UYU in the last, 3, 4, 5 years? I don't know, something like that. But one of hers grew back.
The cataract itself didn't grow back, sometimes the cataract is a cloudiness. We should talk about what the cataract actually is first.
Okay.
1 in 3 people over 65 have some cataract, which left untreated can significantly impair their vision. The cataracts are a cloudy or opaque area of the lens. The lens has to be transparent to focus the light properly and for us to see sharply.
Symptoms of the cataract issue is like a glare around your eyes when you're driving at night or something like that?
That's a very common symptom. Glare, problems night driving. The most common, of course, is just blurred vision in general. Sometimes people get double vision, loss of contrast, or color saturation. Now, the cataracts are removed surgically, and we can talk about that as well. Your wife had hers taken off, and that worked out great. But when the technique of cataract surgery we leave a little membrane in place to help support the new lens.
Oh, I see.
Okay, and it makes the surgery go safer. It keeps the eye intact. And that little membrane, called the posterior capsule, represents a capsule around the original lens. We leave that to support the new lens. Occasionally, over time, that extra membrane develops a bit of a haze. It's called a posterior capsular opacification, sometimes referred to as a secondary cataract. Okay. Now, that's a minor problem in that it can be taken care of easily in the office. We just trim that film off of there with a laser once the lens is securely grown into the eye.
Okay.
Right.
Yeah, okay.
Then we don't need it anymore.
Okay.
So, and that was taken care of for...
She said to me, instantaneously, it was fixed. You know, she got up off the table or whatever. Hey, this is perfect.
Good.
Interesting.
That is just positively amazing.
Well, I wanted to take a second. We had a caller who had some nice things to say about you, Dr. Turgeon, and she had a procedure called a DMEK procedure. And can you share with our listeners what that is and what it did for her?
Sure. Well, the MEC procedure, DMEK, is a newer form of corneal transplants. So one of the things I specialize in is corneal transplantation. Why would you need a corneal transplant? The cornea is the front window of the eye, and it can go bad for a number of reasons. The most common reason is probably a disease process called Fuchs corneal dystrophy. This is a hereditary condition where the cells of the cornea decompensate or cloud over time. In the past, we would do a full-thickness corneal transplant or a penetrating keratoplasty. We would take an instrument called a surgical trephine, which is basically like a circular knife, and cookie cut the central cornea out of the eye, get a transplant, somebody who donated their eyes, and bring that and sew that in place. And that was successful. But it took about a year to 2 years to heal.
Wow.
With lots of sutures, and sometimes people needed contact lenses afterwards to see. So the procedure has evolved. Instead of transplanting a full-thickness cornea, we started developing, about 10, 12 years ago, developing just a layered transplant, and that was called an endothelial keratoplasty. At the beginnings, it was just a layer of cells, the endothelial cells, which is a layer of cells on the inside of the cornea that pumps the cornea clear of fluid. It keeps it crystal clear. Those cells would go bad. We would transplant those cells in a carrier base of stroma. Then that procedure that was called DESEC. That led to DMEC, which is now just a single cell layer of endothelial cells that is injected into the eye and then affixed to the inner wall of the cornea and pumps it clear. And it's been really a nice procedure. So the corneal transplants has evolved tremendously in just the last 10 years. This is some of the advances that we were saying, why it's so exciting. We weren't able to do this stuff when I started, and now it's becoming routine.
So is this an elderly person? or?
No, it doesn't necessarily have to be elderly. I mean, Fuchs dystrophy, you don't see it in kids, but 40, 50, 60... I mean, the older you are, the more likely
she's saying she has 20/20 vision. Is that right?
Well, I'm happy for her. I'm glad that worked out as well as it did.
Positively amazing.
I would like to make a plug for organ transplantation, though. I mean, we can help a lot of people with eyes. We need corneas. So for kidneys, hearts, lungs, and the corneas, help a lot of people after they're not needed anymore. And so please donate organs.
Wow.
Very good.
Okay, final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy. Hi, Paul White for the Half Off and Hot Buy store in Louisville. Just in, an entire drugstore inventory with lots of good stuff. Toys, electronics, cell phone accessories, women and girls Levi's, beach towels, and best of all, Starbucks coffee. Toys, lots on sale. We have to sell all remaining furniture inventory drastically reduced to add space for incoming merchandise. Also, many final reductions around the Half Off and Hot Buy store next to the Medicine Center Pharmacy in Louisville. Don't miss this sale. You'll regret it. Incontinence. Nobody wants to talk about it, but many people have to deal with it. Hi, Paul White for the Medicine Center Pharmacies. We recently made a large purchase of underpads and adult diapers. Many brands are now in stock and all at half price. You can save many dollars by purchasing these incontinence products at the Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. We also have compression hosiery, many brands in stock, and all at gigantic savings. Stop into Medicine Center pharmacies and save on all your healthcare needs.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking with Dr. Paul Turgeon, ophthalmologist, and we're learning some good stuff.
Well, ophthalmology sounds like a really exciting practice to be dedicating your time and energy to, because it sounds like there's some amazing advances that are always taking place.
That's
true. What are you most excited about?
I guess now I'm most excited about how well the cataract surgical procedure is becoming. It's becoming so refined. It used to be we were happy to get a cataract out and have people have improved their vision. Now the goal has been raised to trying to create as near perfect vision as we can without the need for glasses if possible. So we're trying to not only clear the vision, but improve the vision from where it used to be. And some of the things that enable us to do this are, we talked a little bit about the femtosecond laser, how that enables us to remove the cataract in a more controlled, predictable fashion. It also allows us to correct other minor imperfections of the eye at the same time, such as astigmatism, and allows us to center that lens more accurately. Some of the other sophisticated pieces of technology that's even newer is called intraoperative wavefront aberrometry. Once a cataract has been removed, a device attached to the microscope called an optimized refractive analyzer, or ORA for short, measures the total refractive power of the eye. This essentially allows us to more accurately ensure that we're implanting the appropriate lens power for the eye and increases our chance of hitting our target. And this is especially helpful for people who've had previous laser vision corrections, such as LASIK or PRK, where our usual preoperative measurements and calculations are not as accurate as in a natural eye, virgin eye. The laser and intraoperative wavefront aberrometry have also improved our accuracy when eliminating astigmatism. Astigmatism is an imperfection in the shape of the cornea or the lens that causes images to appear distorted or blurry. During the cataract procedure, the surgeon can use a laser to correct minor astigmatism by making carefully placed incisions in the periphery of the cornea to normalize its curvature. For more severe astigmatism, the surgeon can insert special lens implants called toric intraocular lenses. This allows a person to see more clearly in the distance with less dependency on glasses, although reading glasses are still generally required. Actually, all standard replacement lenses, whether you have astigmatism or not, require reading glasses after surgery. However, if a patient wants, they can invest in special multifocal replacement lenses, similar to bifocal eyeglasses, that correct both distance and close-up vision So reduce the patient's need for reading glasses too.
Very interesting. So why don't we had a call real quick, and then we'll go to the future, okay? Would you mind repeating the nutrition that's helpful for macular degeneration? I remember kale and leafy green vegetables, and there was something else.
Well, you want to try to increase your doses of antioxidant vitamins, vitamin C, vitamin A, the kale, spinach, leafy green vegetables, fruits, things that are green and yellow, contain vitamin A and vitamin C.
High in lutein, as I recall.
Yeah, high in lutein and xanthine. They also make, it's better if, eat as healthy a diet as you can, 5 servings of leafy green vegetables and fruits per day. If you can't maintain that.
That's a tough one.
Yeah, they do make, there's a number of products in the market that contain lutein and xanthine in them, eye vitamins, and they're available at any pharmacy.
At any medicine center pharmacy.
At any medicine
yes, they are.
Yeah.
All right, so you're excited about the future, obviously. What does that hold for you, and what are your goals for future of eye health and eye care?
Well, there's new advances going on as the development of glaucoma drugs we talked about. There's new surgical advances, such as the corneal transplants that we've discussed, cataract advances, and getting more precision in what we do, macular degeneration. There's even a possibility of developing eye drops to prevent or even reverse cataracts without requiring surgery. There's 2 recent studies in animals that indicate that this may one day be possible. And if eye drops were found to be successful in humans, I think it would have a profound impact on the way we deal with cataracts. But we're still a long way off on some of these things, especially from seeing any type of eye drop medicine to prevent cataracts. So if a person's vision is impaired from cataracts now, I wouldn't necessarily wait.
What exactly is 20/20 vision?
Well, 20/20 is commonly accepted as a standard for normal vision for human beings. Basically, it means good vision at 20 feet away. So if your vision is 20/20, that means you can read at certain sizes of letters on a Snellen eye chart clearly 20 feet or closer.
Okay.
But say Brad has 20/15 vision, and so his vision is better than yours. You would have to stand 15 feet away from the chart to read the smaller letters that he can read while standing at 20 feet.
Okay.
Conversely, somebody with 20/30 vision would have worse distance vision than you.
Interesting. All this time I've not known what 20/20. I knew it was perfect, but I didn't really know what it was. So.
How about your locations and contact information before we have to wrap up here, Doctor?
Well, we have 2 offices. 800 McKinley in downtown Canton, and 6407 Frank Avenue in North Canton. We're open 6 days, 5 and Saturdays once a month to help people who can't make it
and
in
still
during the
taking
regular.
patients.
And sure, we are welcome new patients all the time.
Excellent.
Smoking.
I work with my associates are Larry Carnes, Jerry Macher, Michael Smith, and Philip Dickey.
Very good.
Guess we're out of time.
Glad to have you,
We
Doctor.
could use another hour.
Yeah, we were rolling there for a little bit.
Okay. Thanks, Dr. Paul Turgeon, ophthalmologist, eye surgeon at Canton's Eye Centers of Ohio. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here next Friday on News Talk 1480 WHBC.
The preceding program was sponsored by the Medicine Center Pharmacies.